I am Thrupthi, studying first year MBBS in Bangalore Medical College and Research Institute. So now I will be telling you about the venous drainage of face. Here is a figure which shows the lateral side of face and all the external veins present here. Though this is a complicated figure, it is not really so. The supratrochlear and supraorbital veins join to form angular vein, which is in turn continuing as the facial vein. The anterior division of retromandibular vein joins with facial vein to form the common facial vein, which drains into internal jugular vein. The superficial temporal vein joins with the maxillary vein to form the retromandibular vein. The retromandibular vein's posterior division joins with posterior auricular vein, which in turn form the external jugular vein. Let us see in detail each of these veins. The supratrochlear vein begins in the forehead and it descends down parallelly with the other vein on the opposite side. It then diverges laterally till the medial canthus of the eye, medial angle of eye. It joins with the supraorbital vein. The supratrochlear vein also receives frontal tributaries from the superficial temporal vein. At the root of the nose, both sides of supratrochlear vein join to form the nasal arch. Coming on to supraorbital vein, and the supratrochlear vein is named so in relation to the trochlea present in the frontal bone. And coming on to supraorbital vein, it begins in the zygomatic process of frontal bone and then goes medially deep to the orbicularis oculi, pierces it and then joins with supratrochlear vein to form the angular vein. The supraorbital vein also has a deep connection with the cavernous sinus through the superior ophthalmic vein. The angular vein present in the medial angle of eye runs downwards and laterally below the risorius, zygomaticus major and platysma muscles, and it is oblique, continues downwards along the anterior border of masseter and the surface of masseter and winds around the body of mandible. In relation to the facial artery, the vein is behind the facial artery, you can see here, and compared to the artery it is straight, not tortuous. And now the facial vein pierces the deep fascia, runs on the superficial surface of submandibular gland and joins with the anterior division of retromandibular vein to form common facial vein, which drains into internal jugular vein. And coming on to superficial temporal vein, it is a large network present in the scalp. The network receives tributaries from supratrochlear, supraorbital veins and also posterior auricular vein and occipital veins. The anterior and posterior tributaries join to form the superficial temporal vein at the posterior root of zygomatic arch. At this point, it also receives a tributary called as middle temporal vein. This superficial temporal vein in the substance of parotid gland, it joins with maxillary vein to form retromandibular vein. Maxillary vein is a short trunk which is formed by the pterygoid venous plexus. The maxillary vein lies between the neck of mandible and the stylomandibular ligament. The retromandibular vein is present inside the parotid gland. It has some important relations, like it is superficial to the external carotid artery and deep to the facial nerve. The retromandibular vein is a very peculiar vein which divides. It divides into anterior division and posterior division. Anterior division, I have said that it joins with facial vein, whereas the posterior division runs posteriorly and joins with the posterior auricular vein, that is the vein which lies behind the auricle, to form the external jugular vein. And now coming on to the clinical importance of these veins. This is another figure showing the formation of retromandibular vein in the parotid gland and its division also. The main importance of these veins is that they are the means by which extracranial infection spreads intracranially. There are mainly two communications. The first one is the superior ophthalmic vein, which I mentioned already, and near the ala of nose there is a deep facial vein which communicates with the pterygoid venous plexus. The deep facial vein lies deep to the mandible and communicates with pterygoid venous plexus, which in turn through the emissary vein passing in the foramen ovale in the base of skull enters the cavernous sinus. So here we get an area called as the dangerous area of face or the dangerous triangle of face. It consists of the nasal septum and the ala of nose, upper lip and the area lying in between. Any septic emboli or any abscess can spread intracranially, causing intracranial thrombosis and also meningitis. And there are some other importance also, like the angular vein present here is in close relation with the lacrimal sac. It is anterior actually. So the angular vein is important in lacrimal sac surgery as it may be cut by the surgeon and causes severe bleeding. And the retromandibular vein is used as an important landmark in the parotid gland surgery. That's it. Thank you so much.